Already my wonderful colleague from Hungary, Dr. Markus Gabriella, was mentioning that we need to define puppy farms a bit. I thought I would use the RSPCA Australia's definition, which says a puppy mill or a puppy farm is an intensive dog breeding facility operating under inadequate conditions. And since the health consequences of these puppy farms living there and being born there is like a really, really wide topic, I was thinking I would try to define these inadequate conditions, and we will go through these inadequate conditions as the root causes of the health problems, the physical health problems they imply in dogs. So these conditions mean that there's a lack of basic essentials in these puppy mills, including food, water, shelter. There's a lack of adequate housing, a lack of safety for the dogs living there, lack of general preventative or veterinary care. There is also a lack of genetic planning. And lastly, a lasting trauma for dogs that are kept and bred there. And before we move on to the puppies, because we will mostly talk about the consequences of these conditions to the puppies, I really wanted to give a voice for the mother dogs that are bred there and kept there. And I do believe that educating future buyers and educating people who want to get puppy mill dogs will bring also a change beside laws and restrictions and supervision of these illegal breeders, because I think people will see the cost, the emotional and health cost of these dogs, and that can actually influence in the future some people's decision whether they will buy a cheap puppy or they will actually look into who they buy from. So these mother dogs that are kept in these puppy mills are bred usually very intensely from a way too early age. There was a 2011 study done by Macmillan and his colleagues where they compared 1,169 eggs-breeding dogs, and they matched them with normal dog pairs in the USA, and they found that the owners or the fosters of the eggs-breeding dogs were way more likely to report both health and behavioral problems for their dogs compared to the average owner-owned dogs. There were a lot of signs of non-veterinarian episiotomies on dogs that were rescued or placed to rescues after being used on these farms for 5, 6, 7 years. Also signs of botched cesareans, and both of these non-veterinary surgical interventions are signs of this problem that these breeders pay no attention to the selection of the mates, and also they don't care about the size of the offspring. There is no genetic planning. There is no inclusion of the anatomy of the mother and the father. So very often the mother's pelvis is also not considered. And if they don't want to pay for veterinary care, they will do episiotomies and cesareans themselves, very often killing these mother dogs and the puppies with it. Also, there are really often signs of neglect and abuse on these dogs, and many of them are suffering from chronic illnesses. They are undiagnosed, untreated prior to them being rescued, which is a horrible sight to see. I work at a clinic now in Hungary where a lot of animal rescues come with these animals, and it's just horrible to see these dogs in these really poor conditions. It's very common that we see skin, fur conditions, hormonal alopecia, congenital heart murmurs, or any kind of congenital undiagnosed disease that the animal managed to live with for the past like 5, 6 years. And the two predominant non-fatal medical issues that I can also confirm that I see the most, but I also saw in studies reported, there are problems with their teeth and the eyes of these mother dogs. Also, there are studies done on this topic that if we confine dogs to suboptimal conditions, that will negatively affect their welfare. There is a measurable amount of really high, rising, non-stop high cortisol levels in these dogs, and they seem to be particularly marked for female dogs. And now we know, again, thanks to studies, that these female dogs are also more susceptible to acute and also to chronic housing stress. And not only does these high cortisol levels and this chronic stress affect all of their body, so it affects their immune system, their hearts, their brain, everything, their skin, it also works through epigenetic mechanisms, so it will cause changes in the gene expression of their unborn puppies. And it will affect the physiology and the behavior of these puppies already before they are even born. In rats, we also know, and why would it be different to dogs, that this prenatal stress will negatively impact the dam's nursing position. It will lower the duration of maternal behaviors and the intensity of these behaviors. So these stressful mothers are less likely to be gathering, sniffing, licking, and grooming their puppies. So it's definitely happening to dogs as well. If you ever observe stressed mothers, it's very common that they even reject the puppies or want to attack them. They do not accept them. They do not care for them. And also the ultimate problem with the welfare, with this really high cortisol levels and constant stress and horrible living conditions, is the reduced lifespan of these dogs. It is measurable. We can count for at least 6 months, but that is the average. So we can imagine that some dogs' lifespan is just cut in half from being kept in these conditions. And now that we talked about the mothers, and I really think the mothers' horrible lives will also have an impact on the puppies, as we could see through the epigenetics and the stress. We can actually go on to the actual consequences for puppies. So this poor nutrition that I mentioned, that the lack of proper nutrition, water for these dogs, will have marked effects on their GI tract. Here in this picture, this was actually my dog, Ari. I hope you can see how skinny she is. She was a rescue from a Hungarian illegal German Shepherd breeder. She had bilateral elbow dysplasia, bilateral hip dysplasia, a congenital heart defect, and she was also suffering from chronic malabsorption. She had a lot of diarrhea, and she just couldn't gain weight. Like if she would gain some weight, she would lose it the next week. So I saw it firsthand what it's like to raise a puppy like this. But let's see why this happens this way. So the low quality and the insufficient nutrition of the mother itself during the pregnancy will result in low birth weight in the puppies, also very often actually a lower number of puppies being born. But in these cases, it wouldn't be a tragical problem. Unfortunately, there is already at birth an impaired fetal GI development. So we often see that these puppies will not produce enough digestive enzyme, and already their mucosal barrier in the gut is not working properly. So they have already from a very early age problem with absorbing nutrients. And these puppies are also born with microbiome dysbiosis. And I will return back to this, why it is also a long-term and also systemic problem for a dog. But I can tell you right now that there are a lot of local effects, including acute diarrhea, hemorrhagic gastroenteritis, or the malabsorption of the nutrients. This picture was taken also in Hungary. Here there was a breeding facility that was breeding Belgian Shepherds and German Shepherds, and the shelter I sometimes volunteer at was rescuing these dogs. So you will see a lot of pictures of these dogs in the presentation. So now we went through the poor nutrition of the pregnant mother dog, but what about the poor nutrition of the dog during lactation and weaning? So my colleague already mentioned that there is very often an insufficient amount and also an insufficient quality of colostrum that is being produced in these moms. So there is also an inadequate passive immunity transfer to the puppy. So they are already way more susceptible to diseases in their area. And also very often we see abrupt or improper weaning onto really low quality diets. Very often these puppies are not even fed puppy food, but grown-up dog food, and also a really cheap version of that. So this GI stress will absolutely result in chronic diarrhea and improper absorption of nutrients. And we will see what consequences that comes with. So there are a bunch of long-term problems originating from these consequences. So this chronic malabsorption will lead to early malnutrition. There will be so-called fading puppy syndrome. These puppies are very often not growing properly. They have all kinds of musculoskeletal diseases. Very often they have GI problems. They are vomiting. They have a lot of diarrhea. They just can't keep the nutrients in their body. The risk of food sensitivities are measurably higher for these dogs, so this will result in long-term problems for sure. And their susceptibility to food allergies and sensitivities for the rest of their life is also increased. We often see IBS or other chronic gut disorders with these puppies that the owners have to fight with their whole lives. Also, the poor nutrition will lead to musculoskeletal developmental problems. We often see impaired bone development, also because of the improper amount and ratio of calcium, phosphorus, and vitamin D, and these bones will be prone to fractures, deformities. As you can see, this is another poor German Shepherd. Actually, the owners didn't even notice that the dog is not growing properly. That's how they bought it as a puppy, and that's how they brought it in to the clinic for its first vaccination. This dog was never vaccinated, and on this picture, I think he was around like 5 months of age. Joint deformities are also very common, osteochondrosis and osteochondrosis dissecans. Stunted growth and reduced muscle mass is seen in these puppies very often. And from vitamin E deficiency and selenium deficiency, we can also see a lot of neuromuscular symptoms in these puppies. And these neuromuscular symptoms sometimes stay with them even long after you corrected the diet. Hyperparathyroidism, secondary to nutrition, is also common in these dogs. We can also see other effects. If you look at this picture, again, German Shepherds, we see a lot of these in our clinic. These were brother and sister. As you can see, they're actually extremely fearful. The female is standing up. You can see that the hips are not in the right position. The flanks are touching each other. And both dogs are actually extremely fearful. Maybe the brother who's laying down seems more calm, but he was just completely shut down. He was trying to dissociate from this whole world. Unfortunately, all these effects are also seen on these puppies. So we can very often link these GI problems and this microbiome dysbiosis in these puppies to later on impaired neural development and brain biochemistry. And my wonderful colleague, Dr. Sátori Ágnes, is going to talk about the behavior problems of these dogs. But let me stop here for a second. If you can already see that the problems already start with a stressful mother dog who is malnourished, and then already these puppies have no choice. They will be born with impaired neural development. They will not have the right brain biochemistry. So how are they supposed to have enough serotonin and enough dopamine? How should they live in our world properly if already they are born with this disadvantage? Their immune function is also not good. They have a lower pathogen protection than well-vaccinated healthy puppies. The skin, coat, and weight problems are also all linked to the previous reasons. And we can also see development eye disorders, for example, retinal degeneration, if they are not fed enough taurine, for example. And the behavior problems are very, very common in these dogs, and we can partly link them to the gut problems and the poor nutrition. The lack of general preventative or veterinary care that we can see in these farms also lead to a really, really wide range of issues. They often have internal and external parasites, high rates of gastrointestinal worms, coccidia, external parasites. So most of these dogs are infected by all kinds of worms, fleas, ticks, and mites. It's horrible. Also adds on to the stress of these poor animals and their already existing diseases. Bacterial and fungal infections are also very, very common, especially on their skin. Also, leptospirosis, brucellosis, ringworm, extremely often seen in these puppy male dogs. The puppies are also often unvaccinated, as you could see in previous presentations as well, or they are vaccinated inappropriately. Most of these breeders have no idea how to time these vaccinations. If sick animals can get vaccinated or not, they really like to do cost cutting or fraudulent records. So unfortunately, I also ran into cases where they were working together with some veterinarian who would just sell them the vaccines or would just stamp already the empty vaccination books, and then these breeders could fill out the details. So it's no wonder that the outbreaks of these infectious diseases like parvo, distemper, or adenovirus is really common, and a lot of puppies actually die from it, and the survivors can develop actually long-term health problems, neurological issues, GI problems, skin disorders, etc., etc. A lot of these puppies also come with unchecked congenital disorders. Like I brought up my puppy, Ari, with the hip problems, elbow problems, and the heart defect. She actually ended up our clinic because she was first bought by a family, and then they brought her to a veterinarian who diagnosed her heart murmur and said that she has to be put to sleep. Then they brought the dog to us and they were like, okay, we just want to get rid of this dog. We tried to bring it back to the breeder, but the breeder was nowhere to be found. Later on, that woman was actually arrested because turned out she had multiple puppy mills that she was running. But yeah, very often the owner is faced with this unchecked congenital disorder first time they bring their puppy to the vet. Very often, these puppies also have untreated injuries like ear infections or injuries to their tails or paws. Very often, the other dogs or their mom causes their injuries, orthopedic issues that could be corrected if a breeder would spot them on time. But instead, these puppies just keep suffering from them until they are sold eventually, and maybe the future owner can help them. But very often, these issues could be corrected if caught early on, and later on, the dog just has to live with it with a chronic disorder. Antibiotic misuse by this breeder is also really, really common. Very often they're trying to mask infections before selling the puppies. That can also lead to resistant bacteria and can affect every other animal and us humans as well with these resistant bacteria. The lack of genetic planning and improper breeding practices that are mentioned before partly are overbreeding, where the females are forced to breed every heat cycle. They don't have any recovery time. They start very early on. And once they are useless, they are old, they are like 6-7 years of age, they are often just dumped or deposited to shelters. This picture is actually taken from this German Shepherd and Belgian Shepherd illegal breeder. Here they were already rescued and they were living at a rescue organization before they all got adopted eventually. I wanted to include just one happy picture at least in this presentation. Inbreeding is also a very common practice, so close relatives are bred together, and because of there's usually no screening of the breeding stock, hereditary or genetic disorders that could be prevented with proper screening and with actual genetic knowledge are very common in these puppies. So we can see hip dysplasia, heart defects, double Merle syndrome, hereditary deafness, blindness, dwarfism, the list goes on. Any kind of genetic disease is common with these dogs. What I observed is that these illegal breeders are very often lack the really basic knowledge of genetic diseases of the actual breed they are dealing with. So they have no idea how not to produce like blind puppies, even though it would be like some basic knowledge of like which colors not to put together, but they even lack that knowledge. The early separation from the mothers, they are very often weaned off, or not even weaned off, they're just taken off from the mothers really, really early, also comes with all kinds of socialization issues and health problems. The lack of adequate housing and transporting these puppies all across Europe also comes with issues. It is very usually overcrowded. There are too many dogs and puppies confined in small places. And it's a really, really high noise, high stress environment that we talked about before. The hygiene is also incredibly poor. So no wonder that these dogs keep catching viral and bacterial and fungal infections, and they can't even heal from one because they are already infected with the other. They are also constantly exposed to urine, feces. The cleaning is very, very inadequate. The lack of ventilation causes really high ammonia levels. They are also exposed to airborne pathogens, and all these viruses are way more easy to transport in this horrible environment to these dogs. As we talked about before, or like my colleagues talked about before, very often these dogs are exposed to extreme temperature, direct sunlight, or rain, and sometimes the opposite is true. They have never literally ever been outside. So some dogs are here for years and they've never stepped a foot outside in the outdoor world. They never stood on grass or felt the sunshine on the skin. Also, there's like a really, really big problem, the lack of human contact and lack of socialization. Or if they are in contact with some animals, very often they're also afraid of humans. So what these puppies see as an example early on life is a stressed, also not socialized mother who might be abused or mishandled by these breeders. So it's a really, really bad start of life in this really sensitive early socialization period for the puppies. And what I also wanted to mention, that there's like a really big consequence for humans as well. Here you can see one of the rescue ladies that work with us, bringing two shepherds to the clinic for a checkup. And this is Ari again, my dog. You could hear it before that there's a great zoonotic risk to humans. We can catch diseases. Our children, our families can catch diseases from these people, from these dogs. Let it be giardiasis or Campylobacter infection. But let's not forget about rabies, a deadly disease that we really do not want to risk to spread through the countries with these dogs. And I really would want people to be aware of all these risks. And there is also high material burden, the treatment and medical conditions that we have to treat in these dogs. Ari had like 2 hip surgeries, heart surgery before she passed. It was not cheap, of course, and also it came with a great emotional burden. People who want to buy dogs out of love because they are cute, because they were easily available when they wanted a puppy, they have to be aware of these physical health and behavioral health consequences of these breeders. So they are aware of it, that it will come with a burden to take care of a chronically ill puppy, materially and also emotionally, and also when they have to decide about when to euthanize this dog, or does this dog even have a quality of life, this is going to be a huge emotional burden for them. Animal shelters and rescue organizations are also usually run by just people, not by government organizations. So people give them tax money, they give them donations, they work in their free time, they spend so much time and money on helping these animals that it's a huge burden on them. And as we talked about, there is increasing involvement of organized criminal gangs, and consequent cost of the criminal justice system and local councils is also a great problem in this industry. And I just created like a little image for the end of this presentation to see that a cheap puppy's price is actually involving so many bad things that are not cheap at all. A worn down, neglected mother dog, improper socialization, inhumane housing and transporting conditions, parasites, untreated diseases, lifelong health issues, vet bills, behavior problems, and inherited health problems that could be actually screened, or like there could be screening tests for it. So I would just really like to finish this presentation on the thought that I do believe in education, and I do believe that if people see the emotional side, maybe they are more likely to listen to it. Like maybe they don't care about the practical advices on like how we should regulate and how we should supervise puppy transport. But I do believe if they see the suffering that it brings to the mothers and to the offspring and the puppies, and how risky it is for them to get a dog like this, I hope it can bring a change as well. And thank you for your trust and attention.